Imagine feeling an itch you just can't ignore, a tiny, nagging irritation that keeps coming back. Now, what if I told you that in the elderly, certain itches are not just annoying, they could be a warning sign about their health and even their lifespan? Yes, it might sound shocking, but science and medicine have shown that these subtle signals in our body can tell us a lot about what's happening inside. Today, we're going to talk about 3 itchy places on the elderly's body that could indicate their lifespan is not long and why paying attention to them could save lives. Imagine feeling an itch you just can't ignore, a tiny, nagging irritation that keeps coming back. Now, what if I told you that in the elderly, certain itches are not just annoying, they could be a warning sign about their health and even their lifespan? It may sound shocking, but the truth is that our bodies communicate with us constantly, and sometimes what seems like a minor discomfort could actually be a serious signal that something deeper is wrong. Among these signals, there are 3 particular areas of the body that, when persistently itchy in older adults, could indicate major health problems and even a shortened lifespan. Understanding these warning signs could make the difference between catching a condition early and facing complications later. The first area is the scalp. Many older adults experience a dry scalp from time to time, but when itching becomes persistent, especially if it comes with thinning hair, redness, or lesions, it could be a sign that the liver is struggling. The liver is one of the most vital organs in the body, responsible for detoxifying harmful substances, processing nutrients, and supporting overall metabolism. When the liver is overworked or begins to fail, toxins start to accumulate in the body, and one of the ways the body signals this stress is through the skin. Itchy scalp in older adults can therefore be more than just a nuisance. It can be a red flag for liver disease or nutritional deficiencies that, if left untreated, can severely affect health and longevity. Ignoring this symptom could mean missing the early opportunity to address liver problems, which could have serious consequences down the line. The second area is the feet. While most people think of itchy feet as a simple fungal infection or dry skin, in the elderly, persistent itching in the feet can indicate more serious underlying issues, such as poor circulation or diabetes. Circulatory problems reduce the flow of oxygen and nutrients to the extremities, which can lead to pain, ulcers, infections, and even tissue damage. Diabetes, which is more common in older adults, often shows early signs through skin changes and persistent itching in the feet. What might seem like a minor irritation could therefore be a warning of conditions that not only affect quality of life, but also have the potential to shorten lifespan if not managed carefully. Paying attention to the health of the feet, checking for swelling, sores, or unusual changes, and consulting a doctor can be life-saving. The third area is the back, particularly the middle and lower spine. Many older adults experience general back discomfort, but persistent itching in this area can sometimes signal kidney or heart problems. The skin often reflects internal organ stress, and in cases where waste elimination or fluid balance is compromised, the body may try to communicate distress through sensations like itching. Kidney or heart issues may not always present with obvious symptoms at first, but subtle signs like persistent itching can serve as early warnings. Ignoring them may delay diagnosis and treatment, which could have severe consequences for overall health and longevity. In conclusion, these itchy areas, the scalp, feet, and back, are more than just minor irritations in the elderly. They are signals from the body calling attention to internal problems that could affect lifespan. Listening to these signs, taking action, and seeking medical advice when necessary can make a profound difference. Our bodies are constantly speaking to us, and sometimes an itch is louder than words. By paying attention to these warnings, we not only protect health, but also give ourselves a chance at a longer, healthier life. Most people think of itchy feet as a simple annoyance, maybe dry skin, athlete's foot, or a reaction to shoes. But in older adults, persistent itching in the feet can be far more serious than it appears. It often signals underlying circulatory problems or diabetes, both of which are common in the elderly and can have serious consequences if left unchecked. Poor circulation reduces the flow of oxygen and nutrients to the extremities, which can lead to pain, swelling, numbness, or even skin ulcers. Over time, the skin becomes fragile, making it more susceptible to infections. These infections can escalate quickly, sometimes requiring hospitalization or surgical intervention. Diabetes, another major cause of foot itching in older adults, can quietly damage nerves and blood vessels, a condition called peripheral neuropathy. This not only causes itching, but also reduces the ability to feel pain, making small injuries easy to overlook. Left untreated, this can lead to infections, slow healing sores, and in severe cases, amputation. But there's more. Persistent foot itching may also reflect kidney problems. As the body struggles to eliminate toxins properly, the accumulation of these toxins can trigger intense skin sensations, often starting in the lower extremities. For these reasons, an itchy foot is not just a minor discomfort, it's a potential warning sign. Older adults should pay attention to any unusual itching, swelling, or changes in skin color, and seek medical evaluation promptly. Early detection of circulatory issues, diabetes, or kidney problems can make a huge difference in preventing complications and protecting overall health. Treating the underlying condition, not just the itch, can literally save lives. Back itching, especially around the middle and lower spine, is often dismissed as a minor irritation or dry skin. But in older adults, persistent itching in this area can be a serious warning sign of underlying kidney or heart problems. The skin is a remarkable organ. It often reflects what is happening inside the body. When the kidneys or heart begin to struggle, waste products can accumulate in the bloodstream, fluid balance can become disrupted, and the skin may respond with sensations like persistent itching. For the kidneys, this itching can be an early signal of chronic kidney disease, a condition that is often silent until it reaches an advanced stage. The buildup of toxins in the blood irritates nerve endings in the skin, creating a relentless itch that is difficult to ignore. In addition to itching, older adults may notice fatigue, swelling in the legs, or changes in urination. Recognizing the itch as a symptom rather than just a nuisance can lead to early testing and treatment, which can slow the progression of kidney disease and prevent serious complications. When it comes to the heart, persistent back itching can sometimes indicate heart failure or poor circulation due to weakened cardiac function. The heart struggles to pump blood efficiently, causing fluid retention and changes in skin health. This can manifest as unexplained itchiness, often accompanied by swelling, shortness of breath, or fatigue. Ignoring these signs could delay diagnosis and treatment, increasing the risk of life-threatening complications. The takeaway is clear. What may seem like a minor back itch could actually be a cry for help from vital organs. Older adults experiencing persistent back itching should not brush it off as a normal part of aging. Consulting a doctor, undergoing proper tests, and addressing the underlying causes can make a profound difference in health and longevity. The body speaks in subtle ways, and sometimes an itch is louder than words. So, what does all of this mean for you or your loved ones? These itches, the scalp, the feet, and the back, are not just minor annoyances. They are warnings from your body, signals that something deeper may be wrong. Ignoring them could cost you years off your life, while paying attention could save it. The time to act is now. If you or an elderly family member notice persistent itching in any of these areas, don't brush it off. Schedule a medical checkup, get the right tests, and address potential liver, kidney, heart, or circulatory issues before they escalate. Take care of your nutrition, monitor your blood sugar. Stay active and support your organs with healthy habits. Listen to your body, it is speaking to you every day. What seems like a small, nagging itch could actually be a life-saving alarm. Don't wait for symptoms to get worse. Act today, protect your health, and take control of your life. Your body is giving you a chance to respond. Grab it, because every itch could be a whisper of life, urging you to care for yourself before it's too late.